My name is Baron Short. I'm trained in internal medicine and psychiatry. I graduated from my residency program in 2006 and been doing TMS for many years now. And it's been really exciting to be there at the beginning and to actually really realize we're at the beginning of where TMS is going. Actually, in residency, I was studying internal medicine and psychiatry and found interest in brain stimulation at that time and did one of the first trials with TMS for fibromyalgia and really fell in love with this type of technology. In many ways, how clean it is. It's not involving medication. It's been pretty exciting over the years where we have TMS clinics where I work, and we've treated thousands of patients at this point. We were primarily using TMS for treatment of depression. TMS was FDA approved in 2018 for OCD and in 2020 for smoking cessation. We employ TMS for treatment of all those three conditions. And over the thousands of treatments that I've been involved in, it's really gratifying to see people recover, particularly when they've done everything that they know to do. And so that's been really great to be able to use TMS as a tool to help people with these disorders. So you might wonder, why would you be interested in treating tobacco use? And the thought is that there's about 34 million people that smoke cigarettes. About 16 million people have smoking-related diseases. And nearly 500,000 people die every year. So it is one of the leading causes of death and a preventable cause of death. Nicotine is addictive, and it causes changes in the brain that make it hard for people to make their best decision about smoking. And it causes intense amount of craving so that people continue to smoke despite the cost to their health or their wallet. Less than half of people are successful at actually stopping smoking by a year. So there's clearly a need for other tools and technologies to help people quit smoking. TMS stands for transcranial magnetic stimulation. We run electricity through a magnet that produces an electromagnetic pulse that goes through the skin, muscle, and bone and touches the brain. And it actually can depolarize neurons. And while that kind of initially can sound spooky or strange, it's actually the currency of the brain. The brain is an electrochemical organ, so it's not just changing the chemistry, it's changing the electrical patterning. And in many ways, using a tool like TMS, you're more focally changing the brain in ways that you can't do with medication. It's great to see how deep TMS can intervene over a matter of weeks, give people control again so that they can stop smoking on their own. And they're not needing to continue some type of medication or therapy to stop smoking. So it's been really gratifying, actually, as a physician, to see people quit smoking with deep TMS and sing the praises later. So I think there's this opportunity for TMS to not just be in a few clinics here and there, but actually be quite a pervasive treatment. Not to mention that TMS is still being studied for a variety of other conditions, still at the research level, but certain conditions such as pain or movement disorders, there are a variety of things being studied. So it's very likely that this may broaden into other kind of traditional fields of medicine, such as neurology. I think we're just at the beginning. The idea to say we can use deep TMS or TMS in general to basically turn down or turn up activity in the brain to treat a disease. And so we're just at the beginning of where we're actually going to go with this technology.